And I am a proud supporter of this bill because it will directly impact, in a very positive and pronounced way, thousands of people in the district that I represent. And as I've mentioned in the past on this assembly floor and in personal conversations with many of you, I represent a relatively large district. Parts of 4 counties. It includes parts of the central coast of California. It's considered suburban, rural. And I represent tens of thousands of farm workers living in rural parts of California who struggle to find access to quality, affordable health care. Now, this bill will allow nurse practitioners to practice to the full extent of their training and abilities. Now, look, I served as a county supervisor for 8 years prior to my time here in the State Assembly. On the local level, the best policy ideas that I supported were those that we negotiated and refined over several months, and in most cases, it took several years. Now, my local government experience taught me that policy ideas refined over time with the involvement of all stakeholders led to the best possible outcomes, and that's the best possible outcomes for people. Now, the policy ideas forwarded by this bill, Assembly Bill 890, are not new ideas. In fact, over 25 states already have done this exact same thing. The policy proposal before us today has been tried, it has been tested, and it has been proven to work. This policy idea has been discussed, it has been deliberated, the research is complete, we have the data before us. Californians need us to stand up and deliver on the promise to expand access to care. This policy will do just that, and it'll directly impact the farm workers and those living in underserved areas of the district I represent and in similar regions across our state. Assembly Bill 890 is good public policy, and it is the right thing for us to do. So I urge and I vote on this bill. Thank you, Mr. Speaker.